Great. And for anybody who just recently joined, or putting in some introductions in the Zoom chat. So just like name, where you're based, anything that you're excited about. Also, I do see some of our season members putting in their district, which is also a great idea if you know it. Feel free to add that as well. Sometimes this is a great opportunity to connect. But again, I'm so excited to see so many people coming in from all over the state. And Sarah, if you want to get the slides shared too, then I think we can get started in a couple minutes.
We definitely understand if you need to jump off, given that you're at the hospital. So glad you're able to be with us, Riley.
We're very excited that we have residents who will be joining us and community health workers who will be joining us at Advocacy Day. Thanks.
Well, I feel like even though we know we have quite a few more RSVPs, given that it's 6:36, do you want to kick us off, Crystal? Because I want us to be sure we get through all the information that we want to present to folks and respect all of your time.
Sure. Well, let's get this rolling. Welcome everybody to our Advocacy Day prep webinar. I just wanted to start off with introductions. I'm Crystal Shen. I'm a pediatrician based in the Seattle area. I work for County Public Health, and I co-chair a legislative committee along with Lelach, who's wonderful.
Hi, I'm Lelach Rave. I am also a general pediatrician, also based in Seattle. And I think the other person that I want to be sure that we get to, or the other two people that I want to be sure that we have introduced themselves are Amber and Sarah. So whoever wants to come on mic first.
Hi, everybody. Amber Ulvenes. I am your government affairs consultant, legislative liaison in Olympia.
And hi, everyone. I'm Sarah Na. I am the communications director for the chapter.
So we are extremely excited. I know our staff have been working extremely hard to get lots of logistics together for this big day that's coming up. At today's webinar, we'll go through a little bit around some logistics around what to expect for next Monday and Advocacy Day. And then we'll dive a little bit deeper into some different aspects around effective advocacy and meeting with your legislators. And then we'll talk more and give you some briefings about our top priority issues, so that way you can be filled in and up to date on things before Monday. And then we'll have a little bit of time for questions too. And then I did want to give a shout out to Melina. We're very grateful to them for supporting our Advocacy Day, since we make Advocacy Day free for all members to join because we want to make it accessible. We're glad for that. And then a little bit of a heads up for what to expect. Most of you should have received some emails by now with some information, including maps and everything else, but we did want to very specifically request that you try to arrive early. We're hoping that everybody can get to Olympia and the general area by 7:30 at the latest, just because we've heard that there's quite a lot of construction going on and parking might be more limited, especially during legislative session. Parking could be like a hot commodity, where especially if you want to get parking where you don't have to move your car every 2 hours. So give yourself plenty of time to park. There have been maps that have been emailed out with more information too. Plus, if you check in earlier, you can get your packets, find a table, you can enjoy some breakfast, connect with everybody. I feel like that's one of the really, really fun, amazing parts of Advocacy Day, is seeing so many people and that sense of community, which is wonderful. And then because we have a lot of amazing speakers and a lot of amazing things going on during the program time, we are kicking off at 8 o'clock sharp with our keynote presenter, who is Dr. Sandy Chung, who was the most recent president of the National American Academy of Pediatrics, who's quite an impressive speaker. We'll be starting a little bit before then with like housekeeping and things. So try to get there early. And speaking of different speakers, we have a really full plate that day, including Governor Inslee, and then many amazing legislators who've been really integral for a lot of our work. Yep. And this is just a quick outline of our tentative agenda. The agenda is still being finalized because during legislative session, our legislators are super busy and sometimes they're coming in and out of different things. But this is like a quick outline, and you probably received this in your email too. We will communicate any changes at all. But starting from the morning, we'll have our keynote, Dr. Chung, and then we'll give like a mini update about some of our priorities, especially for those who couldn't join this webinar currently, even though we hope that they'll review the recording too, but we'll get a little more depth today. And then we'll have some time for some information about effective advocacy as well as questions. And then 9 o'clock is when like the earliest legislator meeting would be scheduled. So that's why we wanted to do sort of like a lot of condensed information earlier on to try to get people equipped with everything. And then we'll have Governor Inslee at 10:40. And like in between, there'll be like legislator meetings. So people might be getting pulled. You might have to miss certain speakers and everything else. And we'll also have our annual David Frock Advocate Award, which will be really amazing. And then we'll have lunch at 12 and 12:30. In between, we'll also have some presentations from our community health workers, which is really great. And we should be done by 1 p.m. We also have our chapter board meeting afterwards, where members are welcome to attend, but not obligated to. So depending on when you need to like leave, if you're planning out your day, you can feel free to leave after 1 p.m. if you'd like. So this is just a quick rundown, more to come in emails if anything changes, but we wanted to give you some structure around the day. And then I'll turn this over to Amber, who's going to talk a little bit about your meetings with legislators.
Hi, everybody. I'm really excited to be welcoming you all back to Olympia as well. It's always an exciting and fun day. So you have, most of you have meetings with your legislators or their aides scheduled through the day. This day, they're going to be on the floor, or meaning in the chambers all day voting. So it's a little bit different from advocacy days we've had in the past, where they have been in committee and had more structured time blocks that allowed for a lot more kind of in the legislator's office official appointments. And hopefully people will feel a little more flexible this year about how we are going to achieve that. Give yourself about 15 minutes to get to your legislator appointments, particularly the mod building, which is where the Senate Republicans are this year. You will see their new building under construction here on campus. It's at least 3 times as big as the old new House building. But anyway, they're out in a modular building. And then if you're looking at the screen, you'll see that we have structured some time during the day to have a chance to pull your legislators off of the floor. And that's especially for people who haven't otherwise had an appointment scheduled with them for the day. And so I thought that might be kind of fun for people. It's how I lobby when they're in the chambers. And it means that you would go to the door of the chambers for the caucus that you want to contact. So there are 4 corners, and that's why, like you hear the term 4 corners meetings, like literally the 4 corners for both chambers and both parties. And each of those is their own individual door. And there are notepads, and each are like actual paper notepads, and security guards. And you fill out the paper notepad to say which legislator you want to see, what seat they sit in, who you are, and then a basic message like, hey, Rep. Stonier, I'm here visiting on Advocacy Day. Would you step out to have a chat? And then you fold it. I'll show you how to fold it when we are together for Advocacy Day. And you hand it to the security guard and they take it in. And then you hang out and chat with your friends until the legislator either comes out or you give up. That's kind of the game of being the actual lobby part of lobbying is doing a lot of hanging around. Or you pull 4 people or 6 people and you hope that they don't all come out at the same time. So anyway, that's a little bit about what that process is going to be. We will help you. Nobody has to do it. But I thought it could be a fun opportunity to, hang around the chamber doors. It's pretty busy and exciting, and potentially have a chance to have a few in-person moments with your legislator. So collaborating with your district, we usually have, people are identified at Advocacy Day by their legislative districts, so you can connect with those other people and and plan your meetings. So the meetings go so fast. They're maybe 15 minutes, sometimes they're 10, and sometimes they might be able to give you a little bit more time because they're so happy that you have traveled to come and talk with them. But that means, like, let's say you have 6 people that are going to your meeting and you have 15 minutes, please kind of figure out ahead of time who's going to say what, so you can just get in there and say what you're going to say. And I see that you'll get an email with the other attendees, so that's super organized and will be helpful. Okay, so any questions, excuse me, about that part? Okay, I think we can move on. Okay, I think this is my part 2, talking about advocacy. For some of you, this is definitely a familiar spiel. But it's a great idea if you can come into a meeting knowing a bit about your legislator, familiarizing yourself with them. ledge.wa.gov has bios and information on each legislator has their own webpage. So that's really helpful to know your district and who your 2 reps and your senator are in your district. And, sometimes it might be where you live, or I probably shouldn't say this. Sarah Na could correct me, but I was like, it could be where you live. It could be where you practice. But it's a good idea to prepare what you want to say. And I think, you'll have a little bit of time to do that during Advocacy Day, especially when you're talking with your cohort from your legislative district. But who you are, what your issue is, what you want them to do, and then a story. Story is a really important part and what makes your meeting memorable and I can share stories too when I meet with legislators, but it's not as effective as, when you can say, I know this family and this was their experience. And then really start at the very beginning. So, they either, before their meeting with you, they probably talked to their, the local water district and and a plumbers union. And, so they just need a total orientation to our, like, I live in your district. I am a pediatrician. We're having our advocacy day. So start from the very, very basics and assume they don't know anything about your stuff. I don't know, they probably know stuff about other things. And some of them, of course, know our things too. Some of your meetings will be with staff, or they'll switch to staff at the last minute. That's really normal, and try to just be able to roll with that. It can be disappointing, but it's still really helpful to meet with a legislative assistant, and most of them work really intimately with their bosses and share information with them well. Next slide. So at the meeting, this is going to be, some advice for how to do your meeting. Some of these notes are a little repetitive from stuff that that I've been saying, but I think it's important for you to know that pediatric care providers are highly trusted by legislators, among the top trusted members. So when you come in or you meet with them off of the floor, I think that you should expect a gracious greeting. They are grateful for your input. And let that give you just tons of confidence, that you are there to bring information that is helpful to them in their decision making, and that you are a trusted constituency. Please feel free to ask questions of them, and answer their questions or offer to follow up. Either follow up in an email, which is a good chance to make another touch with that person, or let me know and I can follow up. Next slide. And then asking for a commitment. This is always helpful because there, oftentimes and I find myself doing this too, but you just are educating a member about your issue and they'll just say, okay, great, thank you. But then what? So it's great if we have a bill to ask them, how do you plan to vote on this bill? Or will you support this particular budget request? I think they appreciate it. So go ahead and do that. Next slide. Okay, any questions about that section in your advocacy? And we'll go over a bit of this on Advocacy Day as well, if there's anything that you can think of, and I'll be there too and happy to help out. Okay.
All right, so now let's get into some of the real meat of this in terms of what are the issues that the chapter has prioritized this year and what are the messages that we are hoping you will bring to your legislators on Monday. You can go ahead to the next slide. So we've had 4 primary priority issues this year, and we'll go through all 4 of these and hopefully give you all the information you need. And this is where, I know we haven't had questions so far, but this is really where, if you do have questions, please ask, because if you're not, and even if you are in the weekly legislative committee meetings, you may still have questions. And we want to be sure that people are walking in feeling confident and comfortable. So let's jump right in. So the first of our priorities is funding of community health workers in pediatric primary care. And we actually have a few of you on the call today. So as I'm going through, you all know what you do even better than I do. So please feel free to jump in here. Community health workers. If you are not at a practice that has them, you may not know what they are. And it's fair to think that many of our legislators may not know what community health workers are either. So let's start there. They are non-licensed members of the clinical team. They're most often part of the community being served, which means that we aim as much as possible to have ethnic, racial, language congruency between the community health worker and the individuals in the practice. And if it's not congruent, at least having knowledge of the communities. And those individuals can act as a bridge between the families and the health system, between the families and other social supports that they need. So some of the things community health workers might do in a pediatric primary care setting, they might facilitate timely access to mental health care. They may help address the family's health-related social needs or resource needs, and they can help enhance the quality and cultural competency of the care that's delivered. Where are we in the state of Washington? The current biennium, so the current 2-year budget, which is the way that we budget in the state of Washington. The legislatures put together a 2-year budget, funded a group of community health workers for 2 years, beginning in January of 2023. So just over a year ago, this program pilot started. Because it's a 2-year cycle, the funding is going to end in December, and the legislature doesn't go back into session till January of next year in 25. So the funding will be over before the legislature gets to refund it unless they add funding before they leave this session. Hopefully that timing is clear. So we are really pushing for them to do that. That's the urgency around this request. With the initial funding, they funded 30 clinics, including 7 tribal clinics. And we've already seen some really significant impacts in those clinics' abilities to address health-related social needs and improve access to behavioral health care services. So we feel like this is working, which I think all of you intuitively know, of course it would work, because how stressed out and maxed out are all of you trying to meet everyone's not only physical health needs, but social health needs and behavioral health needs. And having someone in your office, someone who's part of your team that you can do a trusted handoff to, who can help with all of that, is obviously huge. You want to go to the next slide. So here's what we're asking for. We're asking to continue the existing funding for pediatric community health workers for another 2 years. And the numbers are on here. It will cost approximately $2.15 million. GFS is general fund state. So there are different pockets of money that things can be funded out of. This is the general fund of the state of Washington. We're also asking for the legislature to establish sustainable funding for care coordination by increasing some screening reimbursement for kids who are on Medicaid or Apple Health for Kids. And that also is about $2.5 million general fund state, but there's a federal match for that. So we're going to draw down the same amount of money from the federal government if our legislature puts in this cash from the state level. And Representative Callan and Senator Warnock are our champions for this request, and these are budget requests, meaning that certain things get put through a process where there's a bill that's introduced and there's hearings and it becomes a law. Certain other things don't go through that. It just goes right into what is the line item on the budget. And these things are budget requests. I believe this is, yes. Okay, questions about this particular priority item, community health worker funding?
I have a question.
Please.
Is the 2.5 million, is that enough for, is that an annual budget to fund the community health workers as they currently are? And then my question is, with the federal funding, is the 2.5 million the maximum that the federal government will match the funding for?
So on the 2.5, as far as we know right now, it'll be a 50% match. Once we get going, it's one of the staff people thought we might qualify for a greater than 50% match, but we wanted to be kind of conservative about that. And so the screening reimbursement that will start in. So that amount, I think, encompasses the rest of, so this is a supplemental budget, meaning it's filling in for the second half of the biennium. And so I think that 2.5 is for 6 months, which, because it will start, oh my gosh, I just literally drew a chart with markers about like how the fiscal years and the budget and the biennium all lay over each other. But I think that starts January 2025 on those screening code reimbursements. Did that cover it?
I think so. So it's not 2.5 plus matching to fund the position. It's 2.5 plus matching to reimburse for screening for social determinants of health. Is that correct?
Yes, it's right. It's for several different screening codes that, so depression screen, there are a few codes that we have listed, but those are for bumping up for the screening, for the activity that you would do, the care coordination that you would need to do for those that screen positive. They are connected because in some settings, that would be work that would be done by community health workers. But this portion of the ask doesn't require community health worker or, has any kind of requirement tied to it. It's just if your clinic, well, I shouldn't say if, you're screening, it'll help fund the care coordination. Thatcher?
Yeah, all right. Yeah, thanks for doing this. I really appreciate all the information here. It's super helpful. It looked like there were a couple of community health workers on the call. I'm at a community health center where I think we have it's fairly similar workers that are able to do a lot of help in our clinic here. It would be great to hear maybe a couple of examples of what community health workers are doing just to provide context, especially for those of us that don't have that service in our clinic.
I think that is a great
Anybody
idea.
that
I
would
don't want
speak
to
up?
put anyone on the spot, but anyone who is a community health worker is willing to speak up, that would be fabulous.
I will also add that Allie Goodyear, I believe, is on the call, and she's our program manager who's been running our Community Health Worker Learning Collaborative. So if the community health workers are feeling a little unsure about how to respond, I don't want to put Allie on the spot, but I'm confident that she could speak to what the community health workers are doing in practice across the state.
I'm happy to talk if nobody else wants to speak right now. My name is Heidi Suarez, and I work with Pediatrics Northwest with Dr. Woodruff and Rachel Lettieri. And I'm a community health worker mainly at our James Center in Tacoma, which is in Pierce County. And our days they're super, there's so many different things we do. I can be pulled into a room to meet with a family with a new baby at their weight check. Mom might be scoring high with some postpartum depression and need some support. They might need a flyer to the diaper bank, or maybe some food banks, or maybe even to get referred into where their closest WIC office is and help them get enrolled in WIC. It might even look like we have a teenager in crisis who needs some crisis support services for mental health. Our days are really varied, and it can be very challenging, but in such a rewarding way.
Yeah, great. Thank you.
Thank you so much for sharing, Heidi. I don't know if Allie, if you want to add anything more, or any of the other community health workers on the call want to add anything else.
Yeah, I think this is Allie Goodyear. Yeah, I think Heidi, thank you, Heidi, for sharing that. I think Heidi can speak to it best. I think in terms of kind of the structure of the HCA grant right now that's funding the community health workers, it's kind of conceptualized into kind of outreach, education, resource connection, and kind of support and coaching. So things like motivational interviewing, and really kind of providing support for those health related social needs that Heidi mentioned. So I don't think I have anything else to add, but thank you, Heidi, for sharing that.
Thank you, Allie. Amy put a question in the chat, and Amber, you started to reply to it. Do you want to take that?
Yes, because I realized there's a piece on this slide that we are missing, and there's a lot of parts to it, and I'm sorry if it makes it confusing, but the 2.15 million is to continue the existing grant program and not do any expansion, but just continue it. 2.15 million is just the amount for the last 6 months of the current biennium in the supplemental budget. And then in the next 2-year budget, we will be asking for some more. But the idea is that we're working towards having it be part of the Medicaid entitlement, meaning that there's a code for billing for community health workers that will qualify for federal match. So you don't have to go through a program. You could hire someone, you could build a code, you could get match. That's what we are working towards. And our proviso will direct the healthcare authority to do the needed work to be able to, to turn the codes on. And the same situation with the screening codes. We currently do not have a social determinants of health specific screening code. So you are officially not reimbursed for that specific purpose. So we're part of this is working towards sustainability and turning a couple of codes on. In the first case, to turn away from using a state-only dollar grant program to turning it part into Medicaid. And then the screening codes, adding a social determinant screen. So I'm sorry that there is a lot going on there, and you don't have to understand all of this at all. Legislators probably don't care to understand all of this too. We're giving you all of this because you might want to know, but your message really for legislators is we want to continue the program that we have right now and move towards sustainable funding in the future that gets federal match, and we don't have to rely on these state-only dollars. That's what they like to hear.
I was just going to chime in that the stories are really great in terms of just examples of what community health workers do and can do as have been provided. And just for people in clinics without community health workers, like all the care coordination and like the importance of that. Cause I'm sort of like, even if all the clinical care is provided, but if there's that final step that's needed to help people effectively connect in with resources to help kids get what they need, right? I think just like showcasing that can be really effective.
I will also quickly add, and I will put it in the chat towards the end of the call, but we have some more specific issue briefs that go into each of our top priorities in more detail than what is on these slides. And they are on our website right now, so you would be able to go access them ahead of time. They also will be provided to you as hard copies on Advocacy Day. So all of this information plus more will be available to you both ahead of time and then on Advocacy Day itself. So it's great to familiarize yourselves, but by no means do you also have to have all of this memorized ahead of time.
Absolutely. All right. Let's move on to our next priority issue, which is free school meals. And some of you may recall that we worked on this last year, and we did get some progress on it last year. Last year, the legislature approved and funded free meals for all kids in either K-5 or K-8 buildings if at least 30% of the students in that building were on free or reduced lunch. And Representative Riccelli, who chairs the Healthcare Committee, came back this year and said, I really want to try and get all kids covered. And you can see the exact language of the bill there. You can also see on this slide that this actually died. So the House version died in the Appropriations Committee earlier this week. The Senate version, and often this is the case, often there's two versions of a bill, one that moves through the House and one that moves through the Senate. The Senate version didn't move forward because they sort of pinned all the hopes on the House version, but now the House version itself also is not going to move forward. The list of names that you see under each of those bills are all of the legislators who co-sponsored each of those bills. So if you know who your legislators are, it may be worthwhile to just sort of peek through that list Because if you see your legislator's name on it, you can thank that person. You can know that that person gets this issue, understands why it's important to feed kids, and you can start your conversation with them in a different place. And so now what conversation do we have? It's not a bill anymore. This can now can move forward as a budget item. So not in law forever and ever, like if it had been a bill, but we can still ask our legislators and are asking our legislators to fund meals for children. So take a look, see if you can find your people. Oh, sorry, go ahead. Go ahead and advance, Sarah. So just a little bit of information to help you with this. About 1/3 of Washington households with children had low or very low food security. And of those individuals who had low security of food, about 3/4 of them relied on food assistance. So this is not a small issue. Many, many children who we all see in our practices are food insecure and are relying on assistance. And the next slide is not going to be anything that is rocket science or surprising to any of you. Providing free school meals does good in so many different ways. One of the things that we have good research on is the fact that it reduces stigma. If you don't have children going into a separate line or offering a separate different card that makes them stand out so that they can get their free meal, they are more likely to access that free benefit because they don't have to be ostracized. They're not looking different. They're not drawing attention to themselves. So we know that there's much better uptake of free school meals when they are provided to everyone. It's not a surprise either that kids who are fed miss fewer days of school and academically do better in school. So when kids are forced to skip meals or they can't access good high quality nutrition, their physical health suffers, their academic well-being suffers. It's a lose-lose. And so I think this is an area that we can advocate for both from health perspectives, looking at the physical well-being of our patients, but also looking at their social well-being and their academic well-being. And what questions or thoughts does the idea of free school meals bring up for everyone? Thatcher. Oh, you're muted, I think.
Yeah, I do know how to do this. What is the cost for this? What's the ask?
Well, I should know that off the top of my head of how much it would be if they went all in. I think it would be, I want to say it's 80 million more. They have put, some money towards it so far, so 80 million annually, but I will confirm that so I can have that for you for sure on Advocacy Day.
And then just in perspective, I don't know, is that a lot or is that a reasonable amount to ask?
In a supplemental budget, so second year of the biennium, which is supposed to be adjustments to the 2-year budget, it is a lot. And I think it's highly unlikely they'll do it fully.
Okay.
One thing that we have heard from some legislators is that they do see options of continuing to scale up. So just like last year, they said, okay, if you have 30% of the kids in your building who qualify for free and reduced meals, we'll extend it to everyone in your building. There's talk of perhaps changing that percent number, or perhaps saying, okay, we'll cover elementary school kids, but not middle school or high school. There's lots of different ways to trim that 80 million number. And we have seen legislators who balk a little bit at the large number, but are willing to entertain smaller bits of this. And that may be the way that this continues to happen.
And I was just going to say that oftentimes advocacy can lead to incremental progress, but that's why it's good to still keep on going for it, because every time we keep on sharing the stories and talking about how important nutrition is for kids, I think that really helps showcase how needed this is, and hopefully that can help still keep on pushing things forward, and we can keep on getting more every time we ask. So
How do other states do with free meals for kids? Is it common for other states to cover this, or where do we stand?
That's a
Amber,
great question.
I know, so California passed this.
I think
Um,
Minnesota did too.
so there
Yeah.
are some states that are doing this. In the state of Washington during the pandemic, we had free school meals for all kids, which is where some of the data around the increased uptake comes from, which was that we saw that the kids who qualified for these meals actually used them quite a bit more when all their peers were also using them. So there
I
are
know.
And I think
Sorry, go
Sorry.
ahead, Crystal Lelach.
I was just going to mention that, like, especially when Lelach brought up the whole, well, we did this during the pandemic. I'm like, this can be done. You know, we need the funding and the other things, but like operationally it can be done and it is beneficial. So just wanted to highlight the point. Sarah.
I was just going to add that I know Massachusetts recently passed free school meals in their whole state, and the funding mechanism was they used, capital gains tax to pay for a portion of it, amongst other things.
I like it.
And one of the other arguments that is often brought out is that there's a lot of admin time and money that's put into sorting through applications, who applies, who doesn't, how do we figure out and sort the kids and create a mechanism in our cafeteria, et cetera, that actually schools save money on that. Now, do they save enough to cover all the meals? Maybe not, but that it's not a complete, like, we're not spending anything right now and we'll be spending a ton. They're spending a lot on the administrative portion of creating a school meals program for some children at the moment. Other questions? All right, let's go on to our next priority item.
Sure. And our next priority is updating our current state statute definition of a vaccine. So you'll see some of this bill language, and like the striked out part is something that's much more narrow and specific, but which isn't allowing for some current like new technology that's in place. So this is a bill that has already been passed along in the Senate, which is great. So they've been making great strides there. So it's SB 5982. And you can also still see like the sponsors on that bill as well as with the House bill. So if your legislator is one of those sponsors, you can thank them for their support for that. And this was agency request legislation from the Department of Health. So we can move to the next slide. And this really talks about like why this is useful. This is mostly just like aligning a lot of different things. So the Department of Health is actually requesting this because this would update this definition that excludes current immunization practices with like newer immunizations, like our RSV immunization, right? We're right in the middle of respiratory season. So you've seen all these things. Like based off of the current definition in statute, the RSV immunization would not be included. So we want to just help make all the wording align to allow this to be allowable. And this wouldn't change other immunization practices, like in terms of policies or vaccine requirements isn't a mandate. And this will just really be beneficial because for families that want to vaccinate their children, this will help facilitate access to the recommended immunizations. And this is specifically for logistical reasons. So on our next slide, you'll find out like a little bit more about that. Like with the second bullet point, if we update the statutory definition, this would help support healthcare providers by preventing different administrative and financial barriers of having to purchase the vaccine outright. So this can be especially hard for clinics that are like smaller practices and other things, partially with the way that vaccine purchasing can happen with the state. There is like an organization where with updating this definition, the RSV immunization would be included and practices could sort of get vaccines at a cheaper rate. So this would really be useful for equity purposes and also just make things more affordable. And this is actually something that's cost neutral / actually cost saving for the state, because the insurance plans are actually in favor of this bill as well. And then like a lot of the vaccines are through VFC. So this would not be something that would pull state money. And if you think about all the children and babies that are on Medicaid in the state who are hospitalized with RSV and the health impact that would be there, as well as savings from decreased hospitalization, this would actually be really beneficial. So if you can make all the wording align to match up with current technologies, we can see good things happen for babies. Any questions?
I'd also just like to mention that the bill passed along party lines in the Senate. So I think important points are that this is, a common sense step for, for public health, and that most families choose to vaccinate. That was the point on an earlier slide that Lelach had added, that they really are listening to those opponents in their communities who are anti-vax or anti-centralized vaccination purchasing. And so I think, tread gently, but it's, that was a disappointing vote. So I don't know, Lelach, did you want to say something more about that?
No, I think it's the reality that you all see in your practices. The folks that you spend a lot of energy, or maybe you don't because maybe you've given up, but the folks that you spend a lot of energy trying to convince to vaccinate, they're a small minority. They take a lot of time and a lot of energy, but think of how many families in your practice come in every day and get their recommended vaccines and are, they understand, they're happy to comply with the recommendations. I think the important thing to reflect to the legislators, if you happen to be speaking to a legislator who is hesitant about this, is that just like the vast majority of people in your practice are getting vaccinated, those are the vast majority of their constituents and the people who are voting. And so those people want to be able to walk into their office and know that they can have access to your office, and get every vaccine that is recommended, or at least have the option to, and not have to hear from their physician, oh, sorry, we don't do the RSV vaccine because it's not part of what Washington Vaccine can purchase because of this outdated definition. Those folks who are the majority of their constituents, the majority of your patients, vaccinate and deserve to have access to all the vaccines that are recommended.
Right, or even if they don't vaccinate, they believe that other people should have the access to vaccines if they choose.
Yeah. And like this logistical fix in the wording would help unlock and facilitate access.
Any other questions on the vaccines? Amy, thank you.
Oh, but I see. Yeah, I think that point of allowing parents to choose is an important talking point. I totally agree.
Absolutely. Any other vaccine related questions? All right, let's go on to our fourth and final priority, and that is the permit to purchase firearms. Those of you who have been in this game with us for a while know that firearm safety is something that the chapter continues to promote year after year after year, and we do it because it is so important and it is such a huge impactor on the health and well-being of our patients. You see here the bill language. The idea was to have a permit to purchase firearms. It would have included a background check, eligibility under state and federal law, citizenship information, fingerprints, firearm safety training program, application fee. You can see a lot of House members and a fair number of Senate members signed on to this. And the next slide will tell you that this has died. So both the House and the Senate versions of this are not moving forward. I would encourage you, you're going to have limited time with your legislators, like Amber was saying earlier, especially if you pull them from the floor. you may not even get 10 minutes. You may get 3 minutes before they run back in for their next vote. If this is something that you feel strongly about, certainly acknowledge your disappointment with this. We are going to come back with this. The legislators know we are going to come back with this. There are, however, 2 bills around firearm safety that are still alive that we, in lieu of the permit to purchase, can advocate for. So if you're going to acknowledge your disappointment, do it, but please then move on to what they can do. Senate Bill 5444, we're missing a 4 there, whoops, is about firearms in sensitive places. And House Bill 2118 is about additional requirements for firearm dealers. So peek through the names of the co-sponsors there, see if your people are on there. And then let us share with you a little bit more about each of those. Firearms in sensitive places is a bill that would prohibit firearms in spots such as zoos, aquariums, certain public parks, and also local government buildings. And so one of the things that you'll notice if you've been a longtime Advocacy Day attendee is we used to be able to go up to our legislators' offices. We used to be able to wander the halls. They are cracking down on that. There are security issues now, and we have to give names ahead of time so that you can get into certain offices. This idea of making places where government meets safe from weapons, I think, is a real threat. Our state government has done things about that, and this would allow local governments on the city and county level similarly to prohibit firearms from their buildings. House Bill 2118 is about establishing requirements for firearm dealers. A lot of this to me sounds like common sense. My guess is it might to most of you as well. Things like if you're going to work in a place that sells guns, you have to be over 21. You have to undergo a background check. You have to have fingerprints. There have to be certain safety features in places that sell firearms. Alarm systems, safe storage practices, surveillance systems, and that the folks who sell firearms have to also work with law enforcement. So if there's a request to trace a weapon, they have to respond to it in a timely manner. If there's any loss or theft or unlawful transfer of a firearm, they have to report it. So in my mind, very basic common sense, how do we make it as safe as possible for individuals who are engaged in this area of business? The next slide just says a little bit about how important gun violence is, and I think you all know this already. Firearms continue to be the #1 cause of death for children in our country, and they're also an important cause of injury. And so really what the AAP has long promoted is this idea of a multi-pronged approach to reduce those deaths and injuries. So it's now 7:27. We're going to try and wrap up on time. What questions do you have about firearm safety legislation?
How likely are the Senate and House bills to pass?
The 2 that are still alive?
Yeah, that'll.
I think there's a chance. Yeah, so the Senate or the House Democrats have shifted to prioritizing the one that is about the dealer responsibilities, thinking that they could get it through and that it's something that the Senate potentially would bring up, whereas that was not the case with permit to purchase. And I think the other one has a pretty good chance too. I think that that's kind of a small bill, and it's the type of bill that could get kind of mired down in the process, but I think that one could make it.
Any other questions about anything in this remaining minute that we have? Okay, well, certainly if things come up, you have received emails from the chapter about the events on Monday. You can respond to those emails, send us questions. We will have more opportunity to talk and deal with questions on Monday as well. Or for those of you who are coming Sunday evening for the speaker and dinner, you can pull us aside and ask questions there. Also, we really, really appreciate you all spending your day with us on Monday. We are so thankful for your advocacy, for your enthusiasm for this work, because that's the way things get done. So really, really appreciate all of you. Thank you for being here this evening as well. And we will see you on Advocacy Day.
Let's get excited. I'm so excited for our Advocacy Day. So glad that you'll be joining us. And thanks for joining us tonight. We appreciate that too.